Hello. Hi everyone. Hello. Welcome everyone to this special live. And I would say that this live is special because recently we've been talking about obesity and we've been talking about factors that can cause infertility, premature ejaculation, and so many other things. So I really have a fantastic person to talk about one of the most commonest causes of infertility, and which is also another common thing that we really see around. So thank you everyone for joining me, and I am going to now invite our special guest. I have sent an invitation. Hello everyone. Hi Varhan. Hi Deepa. I have sent a request to Dr. Deepak Subramaniam and I hope you got it. Hi Tamar. Deepak, did you get my request? I have sent you a request again. Hello everyone. Welcome. Hopefully today's conversation will be a fun and a very interesting one. I'm still waiting for Deepak to join me. I'm sending you another request, Deepak, so if you can accept it, that'd be great. Before we get into the whole conversation with Dr. Deepak Subramaniam, I would really like to say that today's session is to talk about how obesity plays a very important role in causing infertility and how obesity affects sexual health of people. Today's session is not about answering how certain people's obesity can be fixed, or how some infertility can be treated, and this is not like a treatment platform where we will be able to do that. So please ask your questions based on the fact that we'll not be able to treat you or stuff like that in today's life. I am trying. Yes. Yay.
Hi.
Hi
I think,
Deepak, welcome. Thank you so much for
sorry,
doing this.
I think,
No. Oh, I lost you again. Sorry guys, be patient, hang in there with me. We are trying to connect with Dr. Deepak Subramaniam now. Hello everyone. Hello Sandy, hello Prithvi, hello Manu, hello Vishan. Hello Rocky Bhai. Oh,
yeah,
there you are. Hello, yes.
perfect.
Yeah, perfect. Thank you so
Sounds good.
much. And without much delay, I'm going to start off. So we have the specialist today here with us, and this is Dr. Deepak Subramaniam, who is a senior consultant, laparoscopic and bariatric surgeon. He works from Chennai Gastro Care and also GEM Hospital. He has taken his very busy time off to actually talk to us about obesity and infertility and sexual health issues. So let me just start off. In today's world, when there is so much body shaming and people are constantly worried that everybody thinks they are fat. I mean, they may not even be like that, but everybody who looks into the mirror constantly have gotten into a habit of criticizing themselves and calling themselves fat. And, they look at the smallest things and want to get rid of, because we're trying to compete with social media images, and stuff like that. So from a doctor's point of view, what would you define or say is obesity?
See, I think there's a very clear definition, but most of us don't see it that way. Most of us just look at that's what you rightly said. Most of us look at the physical aspect of things, but there's more to it. We all go by this we categorize obesity by body mass index. Okay. So they just put across what exactly a body mass index is. A simple calculation which anybody can do at home using a simple calculator is weight divided your height in meters the whole square. And if you are a BMI of more than 30, which means you come under the category of obesity. The normal BMI is anywhere between 20 to 25, and but today we are seeing a lot people in the overweight category, which is 26 to 30, and obesity category as well. And by this I mean a lot more in India and South India as well.
And what do you think is the reason for seeing more people around the high BMI these days, Deepak? What do you think are the most commonest causes that you think are predisposing to these things?
See, the problem is there's so much of globalization, food as well, westernization of food. I mean, I'm talking more about the place where I am. I'm from India, and here I see a lot of globalization of food. Compared to about 15-20 years back, the availability of a lot more junk food that is available here in India is much higher compared to what it was then. Second, even though people have moved into the aspect of, say, fitness and other things, I would think more if we categorize obesity as central and peripheral obesity. So the abdominal obesity or central obesity, that concept has gone up really high. You all always know that in India we have a lot more carbohydrate diet, a lot more rice, and a lot more things like wheat
Pasta,
and chapati, all these things. So this generally contributes to a lot of obesity around your tummy. And that itself is a big reason for obesity being high. One other categorization of obesity is based upon your waist circumference. It doesn't need to be only on BMI. So if your waist circumference is significantly high, you automatically come under this category of obesity. And people who have this abdominal obesity, which I'm talking about right now, are have a higher chance of developing what is called as metabolic syndrome, which can probably lead to diabetes, hypertension, increased cholesterol levels, etc.
Is there also a genetic predisposition for, South Asians and, basically to be, like you said, especially metabolic disorders and be, for insulin resistance and diabetes? And so is there a genetic predisposition to that as well?
Yeah. See, definitely there is in obesity, if you look at it, there is definitely a genetic predisposition, and in diabetes, I wouldn't categorize the same for dyslipidemia or cholesterol being high and other factors. But but definitely genetic predisposition plays a part. But if you ask me as to whether this is directly contributing for them to giving them a higher chance, no. I have seen families where the dad and mom have been on the higher side of weight, but the child has been totally fine in terms of weight. So they are in the normal BMI category. So you can win over this genetic predisposition as long as you're able to have a good lifestyle and a good diet.
So basically, I think we are coming down to the fact that, educating yourself as to everything, the food and how carbohydrates work, or, how the body metabolism works, and trying to have a healthy lifestyle. And I think balancing out, eating a little bit of junk and balancing out with a whole lot of other healthy food. I think all this plays a very important role in a person actually being obese or not. Is that right? Is that what you?
Yeah, so food is one big factor. Food is definitely a big factor. The other big factor, I think, today is the amount of the children as such, or even the teenage kids. Right now, I don't see much teenage kids going out and playing out in the park or playing out in the garden. There's a lot more things they do.
The laptop and the phone. Yeah.
So that's becoming a very big factor today. And this also contributes a lot more to their mental health on this aspect. I know that we always know that obesity and mental health always has a big relation to each other. So I see it going in a very, very big vicious cycle. Leave it like this, another 10 years down the line, we're going to see a lot more obese people around in our
and depressed people, because
Absolutely.
It is going to.
Yeah.
Okay, and I was also going to ask you, so in your practice, how often, I know you'll be seeing the majority, but what I want to say is, how often do you see obese people who also talk to you about them having sexual problems? How often does that happen? How common is it?
It's pretty common, actually. I would more than sexual health, I would say I have a lot of patients who come into me, couples, married couples, who are on the higher side of the BMI, coming with infertility issues, wherein they have tried other methods to sort out the problems, but then finally it has been the root cause being obesity. The gynecologist or the urologist who's dealing with them send them to me for a weight loss procedure, or it could be a weight loss, whatever weight loss aspects that we can look at. So that's something which I see very common. And what I really I found out over these years is that this sort of infertility is really going up high. I would probably have seen about 2-3 patients in a year in about 7-8 years back when I was starting off with obesity work and stuff. Today I'm seeing them on a routine basis, and I fail to understand whether it's because of the rising numbers of obesity or rising numbers of infertility, or because they are.
Or do you feel like more number of people are actually coming out?
Yes, definitely. That's happening too. There's no doubt about that. Definitely today it's not a taboo anymore that people are not worried about that. They want to come out and say that, I have a problem, sort me out. That's definitely there these days. No doubts.
Yeah, because we're encouraging that, isn't it? We are like, yeah. That's true. Sorry, and the next thing I really wanted to ask is, like, I know you came straight to like infertility. So when we come to infertility, I know that there is so many types of infertility, and so when we're dealing with obesity and infertility, what is the most commonest, like, how we have erectile dysfunctions, we have premature ejaculation, we have a whole range of things. So what is the commonest thing that causes infertility that you see?
See, I have seen in women, it's polycystic ovarian syndrome, PCOS, and that seems to be a very big factor. And it's the most difficult factor also for a gynecologist or anybody to treat them, because I find that this is a vicious cycle. Obesity, PCOS, infertility is a vicious cycle. Somewhere somebody has to break this cycle, and the only way to probably break it is to get your weight down. And how do you get your weight down? There are multiple different methods, and so when we try to put them across the various options for weight loss, sometimes certain options don't work the same for every single person. So it's actually very, very customized. So I've seen 2 people with the same BMI, when I put across the same type of mechanism, say a diet or an exercise or whatever it may be, I've not found the same results. It's actually very, very customized in individual patients. So if I see, for example, a BMI of 32, a female coming with infertility issues, and another female with 32, but age might be a little different. The first person might be an age group of, say, around 27, 28. The other one might be an age group of 34, 35. The same diet and exercise pattern don't work in the same people. So it's kind of different for each one.
So do you specifically, so then you look at a patient as an individual, and do you specifically cater for their needs, or what could be the problem or the issue behind the obesity? Is that right?
Yeah, so only if you look at it, what we do is as a team, what we've started to do is we have a coordinator. What we do is she's basically a dietitian or a nutritionist as well. So she kind of goes with complete detailed history. Generally, we have a gynecologist also in the team if it is infertility related issues or sexual health issues. So she kind of comes into the picture as well if it's a female. If it's a male, obviously we have a urologist involved in the team. So it's actually a multidisciplinary team that 3 of us work together, and we give a customized plan for each individual patient. Sometimes it works. Sometimes we also don't know whether it works or not. So it works. After about 3 months later, we review with them and do certain tests to identify if it's working or not. If it's not working, then we move to plan B.
Do you also have like a gym or a physical trainer in your multidisciplinary team?
No, we actually have in the hospital, we have a gym.
Oh,
in our obesity department in the hospital,
this is what we need to know. Like, people need to know that, losing weight is not like, starving or just going to the, gym. It is, like you said, it's very important, but the people have to understand it's a multidisciplinary effect. You have to concentrate on your diet. You need the nutrition, you need everybody involved. Like you said, you need the medical professionals who are involved. You need the gym, you need your, and do you even have psychologists? So
sometimes we bring them into our, they're not on a routine basis, When our dietitian has done a little bit of psychology training, so she kind of gets an assessment of the psychological aspects of things. And if she thinks that we require a clinical psychologist into the team, we have them on a SOS basis. They come and evaluate them separately. Yeah.
As well. Okay, which is fantastic. I think because we have to consider all these factors when it comes to
So,
it. Like
see,
you said,
to be honest, obesity as such, you need to address it on a 360-degree approach. There's no way you can approach obesity in just one day. You can't say stop eating or eat this much, eat less and stuff. You have to address it in all around the corner, because if you don't address the psychological aspects, even if I do a bariatric surgery for a patient, it doesn't work. It really hasn't worked. I have done it in the past. It hasn't worked. So today the assessment is much a big chunk of that time it takes away on the patients, because it's the coordinator, it's the gynecologist, it's the andrologist, it's me, it's a psychologist, and sometimes a physician. If they have thyroid issues, it's an endocrinologist.
Yes, I was going to say sometimes endocrinologist as well, because the hormonal imbalance, and you have to just, everything, isn't it? Like diabetes, pre-diabetic state, you have to just address the whole lot.
Yes.
And I think it's important for the patient to actually understand that as well. How many ever doctors are giving input, if they are not having an insight and if they are not able to understand what is happening in their system, then they are not able to be consistent with what is expected out of them. Because, I remember in one of your lives, you were saying, Deepak, even after doing bariatric surgery for people, it is very important that they still follow the same, diet, nutrition, exercise pattern in order to maintain what they're doing, so that they don't return and go back to the, weight that they have been before.
Absolutely. I mean, the life pre and post bariatric surgery has to be different. And it's usually motivating if you start to lose weight in the post-surgical era. You start to lose weight, so you're even more motivated. Generally, patients are very motivated when they start to see they're starting to lose about 5 to 7 kg a month. They're starting to really shed a lot of kilos that they've had over many years. But there have been people who have gone back on a bad diet, bad lifestyle, and have regained weight post-bariatric surgery. So it's individual. As specialists, we can only help them to go up to a certain level. The maintenance part, it's totally customized, and how much they maintain really depends upon. That's where the psychologist comes into the picture as well.
Yes. Absolutely. I think that's absolutely right. Sorry, we have a question from one other person here, and they want to know that, I'm not eating properly at all. And in spite of that, I'm gaining a lot of weight, and they would like to know what could be the reason for people to gain weight even when they are not eating well.
So there's a lot. This is, it's actually a very, very common problem. One of the most commonest things that patients come and say is, I don't eat as much, but still I'm overweight. The thing is, energy spent, energy you gain. Energy you gain is through many things. Okay, generally it's through food. Food is what is the biggest source of our energy in our body. I'm going to put it out in very, very simple words so people understand. So food is something where you eat, you gain energy through it. There's also other mechanisms of where you can gain energy. There's multiple metabolisms that pathways that happen in your body through which you gain energy. So sometimes if your basal metabolic rate itself is a little bit on the lower side, so you will be eating less, but still your metabolism does not act as fast as what it should. And you may shed a lot more empty calories into your system, and that causes a weight gain. Now, the most commonest things for that is hypothyroidism. That is, if your thyroid levels are low, then that's one of the reasons why you develop these things. So my honest suggestion is for somebody like this is to get a complete endocrine evaluation and to see if there is any endocrine issues causing this reduced basal metabolic rate. And if they still have, if all that is totally fine, then we can look into a diet pattern of how they are doing it and stuff. That's how we need to do.
Perfect. Sorry, before I go to my question, there's one more question. This is asked by Satvika, I think. And the question is, my weight seems like it is under control and I'm only 27 years old, but are there higher chances of me still being infertile independent of my weight? Can people be infertile independent of the weight? And I think the answer is yes. There are several reasons for one person to be infertile, and obesity is definitely one of the most commonest and correctable reasons, to be honest. And I think that is what we are addressing today. But to answer your questions, Atika, yes, definitely there are many other reasons why someone can be infertile. It doesn't necessarily have to be obesity. Sorry, that was that, Deepak. And then I also wanted to ask, I think I've asked most of the questions. So when you actually fix someone's, okay, let's say they have come to you for weight issues, but they do have like, underlying infertility, and that is what has triggered them to come to you. Can we like guarantee, or can we like tell someone for sure, if you lose your weight, your fertility will definitely come back? Can we say that for sure? Is that something that we can for sure tell them?
So generally, how we do this is one, we get a complete endocrine evaluation and a complete checkup of their hormone levels before even addressing their weight. So if they, sorry, excuse me, if they have another reason for this other than obesity, generally we try to focus on that. If everything else is completely normal, that's when we start to focus a lot more on our obesity. So I can actually strongly say that if no other endocrine abnormalities are there, except for PCOS, PCOS is something which can be corrected when obesity sorts out. But if there are no other endocrine abnormalities, major ones, I can strongly say that patients can get over their infertility once they sort out their obesity. That much is a guaranteed one, over time at least. I mean, I can't say that this happens immediately, but over time, definitely there's a very, very high chance that you can sort it out. Yeah.
Okay. But in that case, would you also say if they tend to put their weight back, to put their weight back, that there is a chance that fertility can, reverse or lost again?
I'm only talking in a very positive aspect. So if you lose weight and you kind of maintain this over time, then definitely you can get over this infertility. But if you regain it, you're going to go back to the same cycle where you were a few years back.
Exactly. So yeah, so it's very important to actually sustain and maintain. I think that is what people have to understand, especially when they're, going to surgeons, and when you're getting surgery done, you have to understand maintaining what you've achieved is very important. And that is what is going.
A glass of water. Yeah.
Yes, please. Sure.
Go ahead.
Please,
you can keep talking.
Yeah. So that is what actually gives you, a thing of, you attain your infertility, and then if you, slack back, don't understand how lifestyle works, or don't understand how, what the sustainability is, I think then it is a problem. And then hoping that, this is going to keep you fertile for the rest of their life is a little bit, not possible. So I think that is very important. And I was also going to ask you, so after somebody who comes in for surgery, let's say, banding or bariatric surgery that you're doing, how quickly can someone fall pregnant after they have gone through surgery and losing weight?
So we generally recommend for 1 year to use contraceptive methods after bariatric surgery, because they are in the phase of losing weight. Generally, the stabilization happens around the 1 year mark. Between the 1 and the 1.5 year mark. Safer side is we say 1.5 years. But if somebody is So
when somebody desperately want to have a baby, Deepak, 1.5 years it will look like it's a long time. Do they get frustrated? Do they listen?
They listen actually, because they would have. These are patients who actually we operate on bariatric surgery. Bariatric surgery are on patients who have tried everything, who have tried every other method of trying to overcome their infertility. It's probably the last method that they come to us. So when we say, you waited for 4, 5 years or 3 years or 2 years or whatever it may be, and now I'm asking you to wait for 1 year, because this is the period where you're going to lose your weight, stabilize, and your PCO gets reversed. And I've had a lot of patients. I would say easily, to my knowledge, I can think of about 50 to 60 patients easily who have come like that to me in the last few years. And 1 year down the line, they have had a baby, a normal, healthy baby with a normal birth weight.
Did they put back a lot of weight after the delivery?
Sorry?
Did they put back a lot of?
About 20 to 30% have. A lot, not as bad as how they were. I've seen that patients who had a very high BMI in the pre-surgical stage, if they've been a BMI of 45, 50 or more than 50, when they lose weight and they become pregnant and deliver a child, they have gained a little bit of weight. But people on the lower BMIs of say about 35, 34 and stuff generally don't. They kind of maintain their weight. But most patients have abdomen sagging, which we have corrected with other methods of weight loss.
Yeah, that's fantastic. Sorry, and is it the same for men as well? Like when you're doing this for men, would you still ask them to wait for another year before?
No, no,
No,
no,
it's
no.
different for men.
It's
Yes.
men. For men, we generally say, once the usual surgical the perioperative period is over, they can go ahead with their normal sexual life, and that's totally fine with men. Because at the end of the day, it's the lady, the girl, the woman who's going to have the baby, and they may have a lot more problems with the child when they are losing weight. But with men, it's generally not the case. Yeah. But
So they
also in
can
men, the
gradually. So
effects.
as they are, sorry.
But the thing is, the effects of the surgery, if they come for infertility and it's purely because of obesity, the effects can be seen only after a few months. So generally, after about 6 to 8 months is when they also their sperm count
They
gets
actually
better.
feel,
And
yes, yes. It looks like
so
it's reversing for them as
yeah,
well.
yeah, exactly.
And they would have visually lost weight by that time.
Absolutely.
Yeah, and it also is a matter of self-esteem and confidence, isn't it? When you
Confidence.
start, yes, because when you start losing weight, when you start feeling more confident, and even if
Yes.
there was a psychological factor to things, there seem to be, there seem to be a shift. There'll be a change,
Absolutely.
and yeah, and they
No,
can
that's
achieve.
that's like awesome because I mean, completely unrelated to what we are talking. The confidence levels post weight loss. I've had patients who had depression and other issues because of obesity, and I distinctly remember this one person who ended up becoming like a triathlon champion in the district of Chennai post
Wow.
losing weight. So she was
All
having
right.
depression. Yeah, she was in an IT firm working, but then post that she became a triathlon champion and she kept moving on and on in all those aspects. So the confidence levels are like
Amazing.
way high, sky high.
Yes,
That's where
yes,
I
and
think it's a life-changing surgery.
yes,
I'm,
yes,
it's really,
I think so.
I feel good about it.
Yes, yes, I think so. And I mean, yes, the surgical aspect of things are there. Yes, we are looking at medical side of things. But honestly, by the end of the day, it is the person who you're making out of this, isn't it? It is the person who you're giving. Like you said, Deepak, I think more than your surgical skills that you're doing and everything, what effect that it has on them becoming a person, whether it's, improving their sexual life, whether it's improving their mental health, depression, anxiety, whether it is also making them a very confident person and giving them that confidence. And I think all of that makes a doctor actually more happy, gives content to what you're doing,
See,
isn't
you
it?
know how it is in India, right? Like, see, the amount of pressure about when a couple don't have a child, it's from all
Oh,
ends. It's from
yeah,
the parents' side, it's from the in-laws, everything. And
yeah,
when I've seen patients coming with the full family, like both the in-laws
yeah.
coming with the with the couple and speaking to me on infertility and obesity, and it's really. And at the end of the day, when they have 1 year when they conceive, and the sometimes I'll be the person who gets the third or fourth call after they've
Call,
informed
of
family that
course.
they're pregnant.
how
That's like I'm not even a
how
gynecologist.
satisfying is that, isn't it?
It's
How
amazing.
gratifying is that?
It's
It's
amazing
amazing.
because I would have not I'm not going to deal with their pregnancy. I'm not going to deal with anything, and I get the call like oh, my wife's pregnant, and
No,
like
but it
wow, this is
changed their
awesome.
life, isn't it? That's
Yeah,
what's very important. And I
yeah.
think most of the time we don't see, laparoscopic surgeons or the bariatric surgeon as someone who plays a very important role in all of the topics that we have talking about: sexual health, infertility, mental health, anxiety, depression, confidence. I don't think people are connecting surgeons with this effect. And
Yeah,
I
we should
think
take
that's a
out the tags that we are surgeons. We should probably start saying that we are obesity specialists.
that's
I
right.
always keep telling my friends in my group that, I don't think we should call ourselves surgeons anymore.
I know, I know. I think you'll sell more if you call yourself an obesity specialist, because half the people are going to be there calling themselves
That's,
obese.
yeah.
So I think that's fantastic. That's fantastic how I think we've gone through stuff about infertility and sexual health. And I think from my side, I really want to say that obesity plays a very, very important role in people's self-esteem, and morale. And when people don't have good self-esteem about themselves and they don't feel confident about their bodies, a lot of the times they don't want to go and engage in sexual encounter because they feel terribly ashamed about how they look. And I think that is a very, very major effect on everything. Like you said, and think a multi-system approach is fantastic, Deepak. What you people are giving is just absolutely great in your hospital. And I think that is what everybody needs to approach. Don't go and see a doctor who looks at one point and says, okay, let's do surgery. No. And I think we have to do exactly like what Dr. Deepak has said now, that, you need a whole team to see what you're eating, how much exercise you're doing, how much is your intake of eating getting burnt or not. That could be something very simple. It may look like you're eating too much, but you're just sitting in the computer and working, because everybody's working from home these days. Everybody works in front of a computer. So it could be something as simple as that could fix anything that you're having, either infertility or mental health or whatever that is. And I think that's absolutely fantastic. I'm going to keep this short and sweet, this session, because I think this is a very key session and I want people to take just the essence of what you've spoken now. Is there any, if there was like a takeaway message that you want to tell with all your expertise that you've got, what would that be? Do you want to say something as a summary for us?
See, I think two things I want to say is, one, I think obesity, or rather, if you think that you are on the higher side of weight, one, never feel upset about it or depressed about it, because there are multiple different ways. I'm not saying surgery is the only way out for obesity. There are multiple different ways. And when you give this holistic approach to obesity, you will actually find out that it's easier actually to lose a lot of weight. But most people, I think, they don't come out. They are in a shell. They always live in a shell. Once they go inside, they live in a shell. To get them out of the shell is the biggest problem. So one thing I want to really address is, okay, you may have infertility, sexual health issues, etc., because of weight issues, but don't get into that shell. And I know it's easier said than done, but there are people who can help you. There are enough people around the world that can help you. And second, I think even if sometimes I find that many people don't understand the link between obesity and infertility and PCOS, and in women especially. It's well established, it's well documented, and I would say even a few doctors don't understand that level of the connection. So that's something which we need to put across and train people or educate them and give them this knowledge that it is reversible. PCOS is something which is not reversible. I've seen many doctors writing pills and pills and pills for months and months and years and years and years, when at the end of the day, the simplest problem could be that, shed your weight, this is going to get reversed.
Yeah.
So that's something which, these are the couple of things I want to tell. And thank you so much, Nive. I think, this was a well-needed session, and you did it really well. Thank you.
Oh, thank you. Thank you so much, actually, for coming and bringing this up, Deepak. And I owe you a big one. You know that. So all credit always would go to you, and I would never forget that. So here we are today for you, and because of you. So I owe you a big thank you and big gratitude.
I'm really glad the way you have come across in the last 1 year, and I know that, and you know that as well, what I mean here.
Yes.
And this is awesome, and keep doing this work. And I've had many friends telling me how good you're doing your work there abroad in Australia, and sometime hopefully soon I meet you here.
Yes, I can't wait. I think it's well overdue. So I can't wait for all of us to meet. So I'll definitely see you soon, and thank you so much for being here today.
Thank you.
Thank you. All right. Bye, Deepak. Thanks.